As a Black woman who treats Black women in OBGYN, I've come to realize there are many issues and problems that patients bring to my attention. Today, we're going to dive into it because I think this is a very important topic. For those who are new here, my name is Dr. Tosin Odunsi. I'm a board-certified OBGYN, and I'm glad to have you here. Here's the first question. Many Black patients have a history of not trusting the healthcare system due to systemic racism and issues with trust. When they come to me, I have to build that trust up, and here's how I do it. When I have a new patient that comes into my office, the first assessment that I make is when I step into the room. Does the patient seem reserved, shy, and agitated or anxious? I follow what the prompts are, meaning the nonverbal prompts. And then as I'm taking a history, I ask additional questions outside of the chief complaint. Because in order to build trust, you have to see the person as a human being. And how do we do that? That's by asking about the patient's life. So one of the things that my patients have continually told me that they like about my patient care, my bedside manner, is that I ask about their families. I ask about any issues they brought up in the last visit. I ask about what they did for the holidays or their last vacation that I took. And I really listen to those things because some of the issues that patients might be having may be related to the things that we don't test for, mental health conditions, or family dynamics or social issues. So I focus on that for a little part of the visit. And then I move on to the history, the physical, which is a very intimate part of the visit. I don't want to jump into touching my patients before I've established that type of rapport. Then when I'm actually doing the physical examination, I tell the patient what I'm doing before I do it. I may even show them an educational video before I do a procedure. For example, for Nexplanon placements, meaning an implant, a form of birth control that goes under the arm, I have my patients watch the Nexplanon or the implant insertion video, and they're actually teaching me how to do it. It's not that I don't know how to do it, but I want them to remember what was done so that if they do go to a different provider, they're able to confidently say what Dr. Odunsi did. So I do that with my patients. I spend a lot of time doing counseling and coaching and inviting questions. So there are periods in my visit where I pause. Do you have any questions? I've given lots of information. And I think those are the touches, the small touches that we can do as providers to make patients feel comfortable, as opposed to, okay, I'm going to do this, this, this. We have to make it patient-physician centered. So I include my patients in the management, in the conversation, so that they can feel empowered, whether they're continuing with me or they go on with another provider. And oftentimes at the end of the visit, they say, I haven't had a provider like you who listened to me, who took the time to make me feel seen and feel safe as well. Those are the big things. So I love what I do. I love making my patients feel like they have a different experience with their provider, because that really changes how the relationship goes, and also patient compliance. They are more willing to listen to recommendations, to suggestions, and that way they can have a better quality of life. And that brings me so much joy. Black women are often excluded or underrepresented in clinical research. This poses a problem because then you can't extrapolate the results of the study or the trials to everybody, and it's not fair to have a certain population excluded. This lends to downstream effects where it's possible that certain treatments, managements, things that are tested don't necessarily work in this demographic of patients. It's important to include Black patients in research so that we can have better treatment options, management options, and solutions to the everyday issues that I see presented in my clinic. A real life example would be when I have patients with hypertension in pregnancy and they develop preeclampsia with severe features. We do have an algorithm and a protocol that we follow that typically starts with labetalol. However, I found that in my Black patients, if I start with hydralazine, the blood pressure tends to stay in the normal range or in just the elevated range, meaning out of the severe range. And in my Black patients, I tend to use hydralazine first. We do have data on it, but just anecdotally, I think if we had longitudinal studies and more information about hypertension in pregnancy, we might see different outcomes, because hypertension in pregnancy and the downstream effects, the morbidity, the mortality, it's preventable as long as you catch it quickly and you treat the patients quickly. So that's just one example of different things that I see in my specialty that I think we need more data on and more inclusion on. Let me start with a story with a real life example. I had a patient during training who was categorized as being a difficult patient, as being lazy, because they were not following what the doctor ordered. And this patient, after the whole team left the room, the patient called me to the room to talk separately. And we're talking about my hair, and I used to do my hair a lot by myself. And they asked, okay, doc, how do you exercise? And I told them my whole protocol, and I found out that this patient was not exercising because they didn't want to sweat out their hair. This is a classic example of cultural competency and assuming that a patient is lazy because they're not losing weight, they might gain weight, and not probing for what's the reason why they're not following doctor's orders. So because the hair was an issue, we were able to discuss different ways of protecting the hair or having the sweat get absorbed with different resources and tools. And just having that conversation with the patient, it opened my eyes to other things that may happen to patients where the culture is not understood, questions are not being asked, and that does a disservice to those patients because it's such a small fix. And it just takes a little bit of effort on the part of the provider to delve deep into the reason why a patient may not be compliant. And the data actually shows that patients are more compliant when they have a physician that looks like them. That doesn't mean that physicians who are outside of the race are not doing a great job. I respect my colleagues, but there's some sort of level of connection when I walk into a room and that older patient who may have mistrust, they light up and they say, I've never had a Black physician. So immediately that wall is broken down and there's trust. So I would just encourage my fellow providers to continue to ask why, as opposed to labeling patients or seeing them as being lazy or difficult. I really don't like that word difficult because you haven't probed enough to determine why the patient is difficult. Is there a social situation that's going on? Is the family dynamic interesting or stressful? Stress can make people behave differently. Chronic pain can make patients behave difficult. And I'm using quotes because I don't see any of my patients as difficult. It just means I haven't asked enough questions to get to the root cause of why they're behaving a certain way. So I want to encourage you as patients to advocate for yourselves. If there's something that your physician is not asking, offer the reason and don't be scared, because they may not be thinking of that question. They may not be thinking of that obstacle that you might have to navigate in your everyday life. And it may not be a you problem. This is obviously a topic that I'm passionate about and needs more time to discuss. If this is something you want to hear more about, or you have questions about this topic, please leave it in the comment. And don't forget to subscribe so that I can keep putting out videos like this. Thank you for joining me, and I'll see you in the next one. Bye.